Sciatica is essentially leg pain, lower limb pain. So when a patient comes in with a chief complaint of lower limb pain, whether it's buttock only or buttock, thigh, and leg, we try to get a handle on what's the source for those symptoms. Is it coming from the spine? So for example, when we interview the patient, we want to ask about the distribution of the symptoms and what provokes and alleviates those symptoms. Because there's certain provocative factors and alleviating factors can correlate with the source, like stenosis versus a disc herniation. We then correlate that with physical exam findings that may implicate an inflamed nerve, or if there's weakness in the lower limb or reflex abnormalities. And then we would then want to look at imaging studies like an MRI or perhaps a CAT scan to identify what is offending the nerve, like a disc herniation or spinal stenosis. When the patient presents with a chief complaint of lower limb pain or sciatica type symptoms, we quickly need to get an idea whether or not the symptoms are coming from a nerve in the spine or another structure. So we'll use clues in the pattern of the pain. We'll use findings from physical exam, and then we'll interpret imaging study findings to kind of put all that together and come up with an impression as to what's going on and why, and then formulate a treatment plan. Now, the treatment plan oftentimes would include things like physical therapy and oral medicines, but we typically see patients who have been through that and either have persistent symptoms or their symptoms are quite limiting to start with. In those cases, a lot of those patients will respond well to an X-ray guided injection of steroid around the affected nerve, anywhere from 1 to 4 injections. Sciatica coming from a nerve in the spine, for example, a nerve that's inflamed and irritated by a herniated disc. There's good data actually came out of Australia 2 years ago that shows that a target-specific epidural, in particular a transforaminal epidural steroid injection, are very effective at reducing the sciatica pain in those patients by and large. So the typical course is improvement over time, and many patients may need certain target-specific steroid injections to reduce those symptoms more quickly.